Hi, I'm Dr. Asghar Husain. One of the most common issues that I see after surgery is that people get stiff. They're struggling with movement. They can't straighten out their knee. They can't bend their knee. And when we're going about the conversation about where we go from here, what I tell them is this. When you can't straighten out your knee, assuming that the doctor is telling you that you can move it fully, then there are two areas of concern. One of them is that you can get scarring in the back of the knee that keeps you from straightening out. And one of them is you can get scarring in the front of the knee that keeps you from bending. And here's the thing about healing. Once you start to heal, the scar tissue starts to contract. That means it gets tighter. So if on Monday at 9 a.m. you are talking to your physical therapist and they stretch you, if you don't do anything until Wednesday at 9 a.m., then you will scar right back to where you were before. So the point of this video is to show you a few simple tools that you can use to get your movement back. But to get that back, you need to understand that it's the time in between the stretches that is going to determine whether you succeed or whether you fail. And that means if you...
Just a quick thought. So what kind of surgery, because I've had knee surgery, I had a torn meniscus. I didn't have any issues with my knee not being able to extend, right? What kind of surgery results in this where you cannot extend your knee or bend it?
It can happen with anything. It can even happen with a trauma. I've seen people who've actually just fallen down and they don't move their knee because ultimately someone told them not to move, just to rest it, and it gets stuck. The point is that anytime you have a trauma, whether it's an injury or surgery, your body initiates a cascade of events where you start off and things turn on, and then they get repaired, and then they start to remodel. Look at it like if a building is on fire, the alarm goes off. That's the first step. And then all these people come around, they try to do something. And then ultimately in the long run, we try to rebuild the mess. And so if you look at that, most of the things the body does are part of the way it's designed. Then we see if someone puts a camera in your knee, what I would assume is that a physician told you, hey, you need to get the knee moving early on, because if you didn't, then you would get stuck. And that's really part of the problem, is when we don't have movement as part of the equation early, ultimately we increase the risk of having a stiff knee.
Are there certain surgeries or injuries that would be more likely for you to have that? Because I know, like I said, with my meniscus, I didn't have that issue.
Yeah, absolutely.
So is that just because of me, or is that more common with, like, let's say an ACL versus a meniscus? Or
absolutely.
Something?
If you have more trauma, if you're doing more dissection, you will create more of that healing response, and you will have a bigger risk. Absolutely. So the more cutting, the more dissection that you do, definitely the higher the risk, at least in theory, of having a stiff knee. And that is why I very strongly encourage people to really, in most situations, get moving very, very early. It's one of the points of making this video is I've often seen somehow someone in the healthcare team of a patient doesn't notice, hey, by the way, you're losing your movement. You really want to get this early. And when you don't get it early, it becomes a problem, because just like a cut on your skin that starts to scab up and it gets tighter, that happens on the inside of us. And when you wait many, many weeks or even months down the line, then you get to have a real problem.
Well, I think there's also a lot of people, especially I think if you're older, because I'm older, so I'm talking from, I think that people also a lot of people have this mentality of, I have to rest it, because they've been told that you got to rest your knee, you got to rest your injury. But that's also extremely counterproductive.
Correct. It's purely wrong. If you rest, you might get function, but ultimately if you rest, you might get comfort, but you're going to lose function.
Right.
And an example I use a lot is if you have a math student who says, I'm struggling with math, I hope that no teacher would say quit school. That's certainly not a solution, even though someone might be quite happy at doing that. You won't get better at math. So if you want to improve movement, ultimately what we all want out of our lives is something that resembles function. And if you stop someone from moving, you won't get better function. And I think I continue to still be baffled why rest is given as a treatment option by intelligent healthcare providers.
And it's amazing how many people I talk to that have knee injuries or some kind of injury, and they feel like they have to rest it more instead of doing something about it.
It's blatantly wrong, actually.
Yeah, and then they gain weight and other issues happen, and then it goes downhill.
Right. Also, what I'm not saying is be crazy. What I'm saying is you have to understand the problem, and you have to be strategic.
Right.
So in defense of many people are afraid, they hurt, they don't know what to do, and they think if I move it, it's going to hurt. I get that. But ultimately, that's why you want to have a competent provider help advise you where to move forward. It doesn't have to be a doctor. It just needs to be someone who kind of knows what they're talking about.
Right, and do your physical therapy.
There you go. And that means if you stretch out your knee fully at 9 a.m. on Monday, and then you stretch it out again at 10 a.m. and 11 a.m. and 12, you are going to improve your extension and you're going to improve your bending. So the point is high frequency, 20, 30, 40, 50 times a day. You can add this to all your activities. No one has to know you're doing a physical therapy program. When you do it at a high frequency, the intensity doesn't have to be much. So if the therapist pushing you is making you hurt, one of the reasons is you're probably not doing this with a high enough frequency. So I'm now going to give you 2 basic tools to use. So most of the time when we have loss of extension after a knee surgery, there are incisions in here. So the first thing you could do is just use gravity. Gravity is your friend. So prop something up under your ankle, make sure there's a little bit of room, and then allow gravity just to let the knee settle. Now, if you need a little bit extra and you can't get there, then when you put your hands on your knee, go above where the incisions are or below where the incisions are. If you have someone you trust, have them put their hands here, and you apply enough pressure to get yourself to 6, 7, 8 out of 10, and try to hold that as much as you can. Watch and make sure you're close to where you need to get to. All you need is about 30 seconds to a minute. All you need is 30 seconds to a minute. Once you do that, you're done. You can do this under a table while you're having a coffee at Starbucks. You can do this on your own. You can do it in class. Again, the key ingredient here is you need it to be a high frequency. So tool number 1 is get a nice little stretch. Another way to do that is you can prop your foot up on something. If there's enough space underneath there, you can get a book bag, put one strap here, one strap here, put about 10 pounds of books inside there, and now you have a nice stretch as well too. So the first tool is extension stretching in a way where the back of the knee is free and you have enough pressure away from the incisions that will get your knee straight. So the second tool is how to get knee flexion. So in order to get knee flexion, what you have to understand is there's often scarring around the kneecap. And if you're going to bend and you just push as hard as you can, what happens is that scar contracts. And so if you bend, you squeeze the kneecap into the groove, which will just cause you pain. So the point of doing the exercises is not to be tortured. The point is to improve your flexion. So in order to do that, the remedy is before you do the flexion exercises, you need to mobilize the kneecap. That means you need to move it side to side and then top to bottom. And then what you want to do is you want to soften the scar that's inside there. And then you want to move it. Because when you do that, you're now, instead of compressing the kneecap into the groove, you're now allowing it to glide and you're increasing the chance of getting your flexion back. So this is called patella mobilizations. And ideally, I like it when a physical therapist is instructing you on this. But I see this is really important, and that's why I'm going to show you.
Wait, do therapists tell patients to do this?
They're supposed to. And you know, one of the reasons I'm making a video, because you could very easily ask, hey, why does an orthopedic surgeon have to make this kind of a video showing someone how to get movement? Isn't that what a therapist does? I'm not doing this to duplicate what they do, but the reason is probably 8 times out of 10, when someone comes in, if they're getting a little bit stiff, the first thing I ask is about how are you taught to move it, and I usually get a blank stare. Now, either someone's telling them and they're not understanding it, or they're not telling them, and usually when I double click on it enough, they're not being told. So part of this is quite selfish to say, hey, look, this is what you need to do. No, that is not happening, and I don't know why. So I'm taking this on my shoulders to show people, hey, there is a way to not get stuck in too little flexion or too little extension, but you have to work at it, and you have to work at it with a high frequency because your body, again, is doing what it's designed to do, and it's designed to scar, and it's designed to heal. And if you leave it in one spot, it's going to heal without the movement. So what I'm saying is that if you move the kneecap and soften that area a little bit too, you're going to be able to bend it easier.
Right, because you have less scarring.
Correct. And no, I don't see this message being delivered as much as it should be.
But now it will be.
So when you do patella mobilizations, you can take your own hand or somebody that you trust, straighten out your knee, and then you want to slowly push the kneecap one way, just like I showed you in the model, the other way. So you're trying to soften up that scar side to side. You're not squeezing, you're not jamming down, you don't want it to hurt. You want to basically stretch that scar on the side of it and on the top and the bottom of it. So then you want to mobilize it up and down, and then you want to mobilize it side to side. And you want to try to do that until it frees up a little bit and you see that the kneecap is actually moving. Because once you know that it's moving, then I know that as I'm bending my knee, then I will allow the kneecap to glide, and I won't allow it to squeeze, and it should hurt less. And so the second tool basically is...
So quick question, why can't you just do this by going to therapy once or twice a week?
No, it's a great question. And one of the reasons I made the video is because part of the healing response, I've mentioned this a few times, is when you get the surgery, the body starts the inflammation response. So it creates a lot of scar, and that scar will bind all the tissues together. So if during the course of your recovery, whether it's from an injury or a surgery, if you don't achieve full movement, what happens within the scar is there is a cell that is a contractile cell, and that's called a myofibrocyte. And what that actually will do is that it will actually shorten the tissue. So now imagine you have a knee, and the knee normally is moving full straight, full bend, but you have this big surgery, and now all of a sudden this cell comes in and it's now contracting the scar. The problem really is if you go in on a Tuesday and someone stretches you to full, but you wait until the next visit, which is a couple of days later, you might have gotten stuck back to where you were before because the body's actually working to create scar and to contract it. So the whole point of doing some of these exercises many, many times a day is you want to achieve the movement that you want. Let's say you want to get it to straight, you want to get it to full straight, and then you want to do it again within an hour or two on your own. So the doing it on your own is really the passing the baton to you and saying, look, here's what you need to do. And then when you come back to the therapist, if you've done your homework, you will be able to advance better.
All right, let's move on.
Mobilize the patella, and then as you're bending it, and you can bend it a bunch of different ways. So I can just use gravity, where I just let my knee hang. And one of the mistakes I see is if the knee is stiff, someone will actually pull the body off the ground to get their knee bent, which is wrong. So you don't want to cheat. You want to let the knee hang. And at the same time, if you want a little bit of extra pressure, take someone you trust or take your other foot and slowly press the knee down. You want to try to get past 90. And ideally, depending on the surgery, you want to get past about 120 degrees. There are many ways to get knee flexion. This is only one idea. The key ingredient in this second tool is not just that you're bending the knee, it's the patella mobilization. It is one of the most common elements that I don't see given to patients. So I'm giving it to you. So when you're going to do whatever knee flexion exercise that you want to do, you're going to start with that. So that is going to increase your chance of having success. But you can use gravity, you can use your foot, you can do a squat, you can do a wall sit, you can bend it up on a wall. There are many ways to do this, but ultimately you want to start with the patella mobilizations.
So do you recommend that patients, when they're doing these two kinds of exercises that you're describing, should they be listening to this music while they're doing it? Would it be more motivational for them?